Here we go. Welcome, everybody. If you are here on Wednesday, August 10th for the Monkeypox What You Should Know web seminar, you are in the right place. Thank you very much for joining us. This is another health presentation in a partnership with the Tucson Medical Center and the Pima County Health Department in the Healthy You series, which is a series of free conversations about health topics that are important to our community. And we're very glad that you're here tonight. My name is Tim Bentley. I'm the Marketing and Advertising Manager for the hospital here. And I wanted to do a little house cleaning and let you know how you can participate before I turn things over to our panel and to our moderator. I wanted you to know that we are recording this tonight. If you are watching on Wednesday, August 10th, you are part of the live presentation. If you are watching after August 10th on one of our platforms, you can for sure participate, and I'll tell you how to do that in a minute. If you'd like to ask a question tonight, you can for sure do that. If you look on the bottom of your Zoom interface, you'll see a Q&A button, and that allows you to ask a question, and one of our experts can answer it directly, or we can bump it up to one of our panelists. You can also chat with us in our chat, but we would prefer the Q&A section. There is media that's watching tonight, and they're very interested, as we all are, in how this affects our community. So just know that if you ask a question, or one of our panelists, if you answer a question, that it may be used in the media. So we wanted everybody to know that. And if you are watching at a later date, you can for sure ask a question as well. If you're watching us on YouTube or Facebook or any other platform, you can ask a question in the comment section, and one of our experts will get back to you. And I also wanted you to know, I'll remind you throughout the seminar, is that if we miss a question tonight, or if we didn't get to your question, we are doing a follow-up email to all of our registrants in the coming days to answer those questions and to provide some more information about questions. So right now, I want to turn things over to Michael Lopez, who is on my screen in the upper right, and he's the program manager for Pima County Health Department. He's going to be moderating tonight's discussion. Michael, I'll turn it over to you.
Thank you so much, Tim. Hello, everyone. Thank you so much for participating in today's conversation around monkeypox. We're very happy to be with you. We have a wonderful panelist of our community members being able to speak and give updates. Our goal is to inform our community, guide them to answers and questions, as well as being able just to be part of the conversation. So we want to thank you once again. Thank you, Tim. Thank you, TMC. And again, thank you so much for our panelists for joining us today. Again, my name is Michael Lopez. I use he, him pronouns. I am one of the program managers here at the Pima County Health Department, and it is my pleasure to help facilitate this conversation today. Before I begin to introduce our lovely panelists tonight, I would like to just quickly go over what to expect in our agenda, if you will, and how things are going to flow for this next hour. So now that we have our agenda, we will have our panelists be speaking about monkeypox in Arizona, what we know currently, as we know things are changing each day. So we want to be able to provide an update around that. We also want to discuss the current state of the Pima County response and what we are working with, and then allowing our panelists to have a specific role in giving an update in particular areas when we get to that section. And then followed by our Q&A, our biggest portion of that. We really want to do our best to be able to answer all the questions that we've received prior to this, as well as the questions that will be coming through during this conversation. And then we'll finally end it with some next steps, things that people should know as we move forward. Again, I want to thank everyone for participating today. I'd like to go ahead and begin introducing our panelists. I would love to start with Dr. Cullen.
Hi, everybody. First off, thanks so much for being here, and thanks to TMC and obviously the Pima County Health Department and the other esteemed panelists I'm with. I'm Terry Cullen. I'm a physician, and I am the director of the Pima County Health Department.
Thank you, Dr. Cullen. Next, we have our lovely panelist, Dr. Nangalingam.
Thanks, Michael. So I'm Sudha Nagalingam, and I'm an infectious disease physician, and I'm the medical director of El Rio's HIV clinic and PrEP clinic. Thanks for having me.
Thank you so much. Next, we have our lovely panelist, Dr. Carmichael.
Hi, I'm Kevin Carmichael. I'm a family practitioner by training, a member of the community for a long time. We're working in HIV for over 30 years at El Rio. Now I'm working part-time for the Arizona Department of Health Services, and I'm really happy to be here to share with my community.
Thank you so much, Dr. Carmichael. Next, we have Mariana Singletary.
Good afternoon. My name is Mariana Singletary, and I am a medical epidemiologist at Pima County Health Department. Nice to see everybody.
Thank you so much. And last of our final panelists, we have Dr. Elliott.
Hi, everyone. Thank you so much for inviting me. I'm Sean Elliott. I'm a pediatric infectious disease specialist at Tucson Medical Center, but I also consult with the county health department on outbreaks, epidemiology, and of course, the current monkeypox situation. So thrilled to be here and to try and answer some questions. Thanks all.
Great. Thank you so much to our panelists. We're going to go ahead and begin our updates, starting with Dr. Cullen.
Hi, so I'm going to give you an overview of what we know is going on in Arizona, then run into Pima County, talk to you a little bit about testing and vaccination, and then the other panelists will share further information. So as you may know, in Arizona, there are over 100 cases right now. As Michael stated, this is a very dynamic, changing situation. So it's hard to predict where we will be, for instance, just tomorrow. But at the current time, over 100 cases in Arizona. The state has designated 3 specific areas of the state to be their hub, what we are calling their hubs for the monkeypox response. Coconino County, which is Flagstaff, Maricopa County, obviously Phoenix, and Pima County. We are the hub for the southern region of Arizona, including Graham, Greeley, Cochise, Santa Cruz, Yuma, and Pima County. The state has done this because, as you know, we are ramping up a response, and the desire is for us to coordinate with all these other counties. So if you are participating or viewing from these other counties, please feel welcome and ask questions specific for your county if you need to do that. I want to talk briefly about the 2 different things. One is testing for monkeypox, and one is the current vaccination status. Testing, as you may know, early on was conducted solely at state laboratories. For us, that is our state laboratory in Phoenix. It is run by the Arizona State Department of Health Services. They're actually a wonderful partner, and they have done the vast majority of the testing for the Pima County Health Department. However, in the last few weeks, the federal government arranged for multiple other private labs to have testing available. The 2 labs that are most frequently being used by healthcare providers and healthcare organizations in Pima County are Quest and LabCorp. However, if a individual case is concerned about whether they have monkeypox or not, they can go to their specific provider, but they can always use the health department. And before we finish up tonight, we will give you some specific information about how to access that. At the current time, we have done a fairly significant number of tests, about 25 from our lab alone, from our clinic alone. We have collected that. We do not know exactly how many other specimens have been collected from other healthcare providers. However, we do know the number of cases we have. As of this morning, we had 10 cases. This number is updated Monday through Friday on our website. There are days where you may not think it's updated because the number doesn't change, but let me reassure you that we are updating it as soon as we can in the morning based on the number of positive tests that have been reported the day before. Now, let me go to vaccination, a topic of interest for many people. As you may know, all the vaccine in the county is currently at the health department. This is a CDC, HHS, and Arizona State Health Service decision. The vaccines that have been distributed in the state are available once again at those 3 hubs, at Coconino, at Maricopa, and at Pima. We do have vaccination available if people meet the criteria for that. Those are known exposure to a patient with monkeypox. At that point, you're called a contact. People may recall that from the COVID pandemic and being a contact to a patient with COVID. In addition, if you have had multiple sexual partners, meaning more than one, with a male or with someone who was born male, you qualify for what we call PEP++. This is pre-exposure, pre-exposure prophylaxis plus dependent as defined by the CDC. This past weekend, we vaccinated 398 people at a large, what we call pod. You may recall if you got a COVID vaccine, point of distribution. And we do have vaccination available at our 3 clinics at the county. Once again, the reason why vaccination is limited is because we are the only ones eligible at the current time to receive vaccinations. Because we have only had vaccination for a few weeks, we have only been doing first vaccinations. This is a 2 vaccination series. The second vaccine is 28 days after the first vaccine, though it can occur after that. And I just want to remind people with COVID, if you'll remember that when we had limited supply, sometimes people got their second shot late. It does not affect the reactivity. At the current, up to right now, we've had about 1,000 vaccines given to the county. We do expect to receive more, hopefully August 15th, and another dose the end of this month. There have been some recent changes with the vaccine and how many doses we can get out of a vial. Used to be 1, there's now an FDA indication that we can get 5. We are in the process of transitioning to that, so that should extend the access to the vaccine. Though right now, as you can tell, if we only have 1,000 doses, we have a very limited supply, and we have what we call a constrained amount of vaccine. I do want to reassure people that we are working closely with the CDC, with the state, and the CDC is working closely with the current administration to try to make sure that there is additional supply. This changes on a fairly regular basis, however. The belief is that there will be additional supply available either in October or November of this year too. And with that, Michael, I will stop and turn it back to you.
Thank you so much, Dr. Cullen. We appreciate that information. We are going to move ahead with our next panelist, but before I begin introducing them again, I'd like to remind everyone that during the conversations that our panelists are speaking about, please feel free to use the Q&A chat feature to ask questions as something pops in your head. And again, we have background folks being able to moderate that and filter that back to us. And when we get to those Q&A questions, we'll be able to answer that. So again, we appreciate your time. Now I'd like to welcome Mariana, who's going to give us some information about current outreach and the role of epidemiology. Mariana?
Hi, well, the epidemiology team at Pima County is working hard to, first of all, keep surveillance of everything that is happening. We begin before we have cases at our county. We begin knowing or following what is happening first of the world, then in our country, then in our state, and finally, we have more work when we detect a case. Mainly, we want to offer education and information on our website. If you go there, you also scroll down. We have a survey that will help us assess doing the assessment for vaccine eligibility. And the other thing that is very important for the EPI team before being in contact with cases is to give support for our providers in education and information in what is happening, and especially in helping with diagnosis. At the beginning, before commercial labs, we need to help coordination testing with the state, with our Arizona State Lab. Now we have some information to provide when there is necessity to a need to test in commercial labs. And the most important thing on that for us on our side is to connect the people that needs a test to care for having the information that they need, that will be the diagnosis, the sampling and the diagnosis. We also are famous for data collection, so we kind of take care of knowing everything that is happening, how many cases, how many people has been testing. And as Dr. Cullen says, it's the EPI team who provide those numbers. We review every morning, every afternoon, so everybody can know what is actually happening. And in the role of epidemiology, after we confirm a case, is maybe the most important thing that people have learned of, maybe from COVID, mainly from COVID, is making the case investigation. And the case investigation will try to connect dots to see if we can know how the person got the disease, and especially do the contact tracing. That is the most important thing for us. Contact tracing help us trying to limit the spread, and also help the case, because we are able to, if you provide us the information, we will do this anonymous report. We will call the person saying, well, we're sorry to tell you that you were exposed, and we will offer preventive measures like the vaccine. We will coordinate, bridge that care, and being able to hopefully stop the outbreak. Beside that, we do some reports that mostly internally, so everybody here at the county knows the numbers and what is happening, but also we communicate with providers and give the last information that we can or we have. Maybe the most important thing for us in EPI at this moment is the people to go, and if you think that you're eligible for the vaccine, please go and answer our survey so we can reach out. Somebody can reach out to you and see if we can all together prevent this, the spread of this disease.
Thank you so much, Mariana. And just to let folks about that survey, you can also find that on our website at pima.gov/monkeypox for all updated information. And for those that are just joining us, I do want to take a moment just to remind folks that you are part of tonight's conversation around monkeypox, what you should know. We have a panelist, esteemed panelist from our community providing information. Again, using our Q&A chat feature to ask questions as as we're going through, and then when we get to our question and answer portion, we'll be able to begin answering many of those questions that are coming through. As you can see on your screen, this is what the website is looking at, some information, also able to get that in Spanish as well. So we appreciate all of that. Again, I want to thank Mariana for that update. Now we're going to go ahead and move to Dr. Elliott to provide us information on a clinical update.
Okay, thank you, Michael. Hey, everyone again. So and a question which came up in the chat, and I'll go and answer this now. Where did monkeypox come from? So the monkeypox virus and the disease we call monkeypox has originally been described in parts of Africa, especially Western Africa and parts of the Congo. Two different, perhaps, types of the virus itself, two different illnesses. And as the name would suggest, there was some origination in other primates, but unfortunately, humans are very adept at being infected by those kinds of viruses. It's really yet unclear how we came to the current situation where the monkeypox virus is all over the world. It certainly has left the continent of Africa and is every other continent in the world. But it's clear that we have a significant number of cases here. What is the clinical disease we call monkeypox? And you've seen perhaps some of the pictures online or read the descriptions. A classic patient with monkeypox is exposed to somebody else with monkeypox lesions or monkeypox pox, basically the spots which are derivating the name of monkeypox, and a close physical contact is necessary for a primary case. So yes, it appears that our first populations are men who have sex with men, trans women, others who have close physical contact during intercourse, but this is not truly a sexually transmitted disease. It is simply being close and exposed to an active pox, and skin-to-skin contact or exposure to infected environmental surfaces is more than adequate to transfer the virus, similar to many other viruses that we deal with on a daily basis. So after that specific exposure, then after a couple days of incubation, the typical patient has a couple days of what we call a prodrome illness. That is, if you've had the flu or you've had another viral illness, or heavens forbid you've had COVID-19, it's kind of like that. So fevers, chills with the fevers, headaches, sore muscles, really tired, lethargy, and then especially patients who have swollen lymph nodes or glands, and they can be anywhere. They could be up here in the neck, they could be in the armpits, they could be in the groin, you name it. So those things together are the classic illness that starts the monkeypox, followed then by a couple days to even up to a week or so by the onset of the actual rash itself. And these typically are small little bumps, which we call papules, maybe with a little bit of a pus pocket on top. So pustule is the medical name for that. And they typically occur clustered, so meaning several to even more than a handful of these little pustules in one specific part of the body, typically the point of contact with the original source. So, for example, they may occur on the penis, they may occur around the anus, the rectum, they may occur someplace else around the mouth if there was oral contact. But the point of original contact is where those pustules first develop. And then they can spread throughout the entire body, typically numbering well over 50, maybe 100 or even more. The key part about these pox lesions is they're raised, they look like pus pockets on top of the skin, and they rapidly get larger and somewhat bloody or purulent, not to be gross, and they hurt. They're really, really painful. And that's important, folks, because along with everything else out there, there are several viruses, which are routine summer viruses, which can also cause a rash, which may be mistaken for or look a lot like the monkeypox rash. Classic example, you may have heard of hand, foot, and mouth syndrome. That's caused by a routine virus called Coxsackie virus. There are several others out there, including herpes, like the cold sore herpes, the genital herpes, even patients with syphilis. So other infections, which are quite significant and quite severe, can look a whole awful lot like monkeypox. But typically, those lesions are nowhere near as painful as are the monkeypox lesions. And they typically occur, for example, hand, foot, and mouth syndrome, like the name says, on the palms of the hands, the bottom of the feet, and within the mouth, in fact, the back of the throat with a sore lesion there. So as we have patients who come to our attention with a possible exposure and a possible onset of monkeypox, the next step needs to be an assessment step. And you've already heard that the county has been doing a lot of that and will continue to do so. So too are your primary care providers. So too are our emergency department colleagues. So lots of people looking for testing for monkeypox. So that's sort of clinically how monkeypox comes through. A very important point I wish to make, and this is unfortunate, but many of our patients have what we call an atypical or a not typical presentation. So they may have only very mild prodrome, so low-grade fevers, if fevers at all. They may feel only a little bit tired, or they may just think, gosh, maybe I just have allergies, because there's that with the monsoon season. And that can be followed by the rash. The rash is uniform for all patients with monkeypox. So without the rash, we're not thinking monkeypox, period. However, there are some patients who initially present not with the fevers, not with the swollen glands, but with really severe pain around their anus. We call that proctitis. And that may be the only presentation. If anybody, this is not to be gross, but if anybody's ever had really bad constipation and it hurts when they try to poop, that's the pain that we talk about with proctitis. So that may be a possible presentation, but it's always followed by the rash. So that's what monkeypox looks like. We've already heard that we are prepared for and have been providing post-exposure prophylaxis with our vaccines. What about treatment? Yes, there is a medication called TPOXX, or tecovirimat is the product name, which either can be given through an IV or given by mouth. It does exist with proven treatment ability against monkeypox, but it was not initially designed to treat monkeypox. It was initially designed to treat smallpox, which is a sister infection to the monkeypox. Patients who qualify or who would benefit from the TPOXX are those who have known immunodeficiency. So here I'm thinking of our patients living with cancer, solid organ transplants on suppressive medications, especially our patients who are experiencing life with HIV and AIDS, and not AIDS that's well controlled, but sort of like, uncontrolled AIDS with a high viral load. those are individuals who are immunocompromised to a degree that we would wish to treat them. Also, patients who are experiencing severe pain from their pox, severe pain if they have the rectal pain, the proctitis, those are individuals who might benefit as well from the treatment. I wish I could say the treatment was a 100% cure within 6 hours of taking it, and I'd be lying if I did. But patients who start the treatment, typically the measure of success is to not get any worse. And then over a matter of 3 to 4 to 5 days, they start to gradually feel better. So just as with other viral medications, for example, the flu, anybody who's taken a flu medication knows that the earlier you start, the better, but it doesn't magically make the flu stop. It simply allows your body to heal a bit more rapidly than it might otherwise. So there are very few doses available in the country of the TPOXX, and those that are available are being guided in their administration through the health departments, including Pima County. So we have protocol in place. It is an investigational drug, which I know is a scary term because it's not been tested specifically in every single patient against monkeypox, but the safety profile has been tested. It is a safe drug. There are no what we call safety events or adverse drug effects that you need to know about. So if somebody qualifies for treatment, then the treatment is a possibility. So that's kind of where we stand right now, and I'll stop there and see what other questions come up. Thanks, Michael.
Thank you so much, Dr. Elliott. And I'd like to go ahead and give an opportunity for Dr. Elliott to give us an update or information about prevention and any harm reduction options.
Sure. Thanks, Michael. And I'll ask Dr. Carmichael to chime in too. But basically, we know the vaccine is available, like Dr. Cullen talked about, but there are some aspects of just our generalized everyday plan that we could do to decrease our risk. So number one, we could consider narrowing our sexual networks. Just decreasing the number of people we're having sex with decreases our risk of exposure. It's really important, at least within 2 weeks from your vaccine, just limiting those numbers of partners decreases that risk of exposure. The other thing is avoiding saunas or bathhouses or large raves, etc., where you might be in contact with persons who intimate contact without clothes, folks who may have a rash, that increases your risk as well. I think it's really important from the cases I've seen here at El Rio that you sort of keep contact with patients you have had sexual relations with. I've had a patient who couldn't recall who his partner was and didn't have any contact information. And the health department needs that, we need that, so we can be able to identify these folks and help them with prophylaxis as well. I think it's really important when it comes to using sexual toys and fetishes, we clean those as well as bedding, etc., just decreasing the risk of exposure. And I think another, just from my experience on the ground so far, is be cognizant if you're having any skin rash like Dr. Elliott talked about, or just not feeling well, to contact your healthcare provider. We've had a patient who's co-infected, so he had monkeypox as well as gonorrhea and chlamydia. So it's really important you talk to your healthcare provider. We're able to test and really sort of piece through that, so we're able to get to the diagnosis and sort of muddle our way through that.
Thank you so much, Dr. Ellingham. We definitely have a lot of questions kind of surrounding this topic as well as the other questions. So we kind of want to move into that area. We're actually on time, so we want to definitely dedicate this last portion of our talk to be able to filter some questions. I'm going to ask some questions that are coming through, whether they were sent to us or during this conversation that we have. So I invite our panelists to, as I ask that question, to feel free to unmute yourself and take that role in that answer. Would be much appreciated. I do want to take a quick moment just to let folks know that we want to thank you again for joining us, that during this question and answer portion, we want to making sure that we are doing our best to answer as many questions as possible. But of course, we know we may not be able to answer every single question, but we will follow up with an email to all the registrants to this webinar, being able to answer questions in the next follow-up days on that one. So we do appreciate your patience on this. But if your question is not spoken or not answered during this particular conversation, we will do our best to answer that and send you information regarding that. So thank you so much. I'm going to go ahead and start with the first question that kind of just came up. So I appreciate everyone's time. The question that I have here is, somebody had asked, why are we classifying people for vaccination based on sexual orientation when it's been proven that it's not associated with this? And I'll let anyone go ahead and speak to that question.
This is Terry. Let me start with this. We are not doing that, but I want to be very clear that we are probably one of the only counties in the country that is not doing that. If you go to other county websites, the first thing you see is how do you identify yourself? We are lucky enough in Pima County to have been able to very quickly pull together a group of stakeholders who reminded us and directed us to the fact that this is not about identity. This is about activity. And so on our website, you do not see anything about identity. And the triage for the vaccine is based on activity as well as exposure to somebody that might have monkeypox. This is a great question, however.
Great. Thank you so much, Dr. Cullen, for explaining that. Next question that we want to go to. This one, this question is around school, so I do kind of want to making sure that we are addressing this kind of conversation. What is the guidance or protocol for schools pre-K to 12th grade? Should school systems be limiting sports that require skin-to-skin contact, such as wrestling, as an example?
I guess I'll handle that as the pediatric infectious disease provider here. That is also a very important question. So far, knock on wood, there have not been many cases in the pediatric population. That's not to say they won't happen, they will. But the current approach by school sporting events or other close contact events is to screen for an active rash of any sort. Perhaps a bigger concern is not monkeypox, but believe it or not, herpes, the skin form of herpes, which is very transmissible, especially wrestling, football, et cetera, and so forth. So as we go forward and get a better handle on the epidemiology, there may be more formal approaches, but my impression is the current approach by school districts and sport programs are all ready to screen for athletes with active lesions and to exclude them from close physical contact, practice, training, competition, et cetera.
Thank you so much, Dr. Elliott, for that answer, excuse me. Follow up with that one. What provider education is taking place for health providers in our community to be able to identify potential monkeypox cases? An example with like urgent care physicians, primary care physicians, et cetera.
Well, I can't speak for outside of El Rio Health, but El Rio Health has about 275 providers right now. And we've been working very closely with Dr. Cullen's team. So we've been doing weekly updates with State of the State in Pima County, as well as quarterly updates with the providers. So there's just been a lot of education when it comes to vaccination. And we have a new electronic medical record system. So we're trying to advise all providers to get that information out about how to get vaccinated through the health department. So I think using both technology, using great social media, and I can tell from my patients, social media has been fantastic in getting the word out about pop-up clinics and just access to vaccines through the health department.
And I'll tag on to Dr. Nagaliam. I'll be actually addressing the TMC providers tomorrow morning at an all-provider meeting. So it really is, as she just suggested, the person-to-person contact, the teaching moments, and then just circulating, being present in the various treatment centers like, hey, just to make sure you're up to date on the current status, education, treatment options, et cetera, for monkeypox. And here is whom to contact if you have questions.
I'll also add that the state of Arizona now, the Arizona Department of Health Services, and my role has now been expanded to encompass monkeypox. So I've been doing some direct teaching with Marana Health Center in Pima County and with other clinicians and clinics around the state. But everybody's on board. It's just the difficulty with this illness, this infection, is that it's really new. I remember it was identified in 1958. Monkeypox was identified. So it hasn't been around that long, and this outbreak is unprecedented. Before monkeypox, I'm answering some of the questions that I've seen come up. Monkeypox was seen in small outbreaks, relatively small, relatively self-limited. There was one of about, I believe it was around 50 people in the United States associated with prairie dogs that were being kept as pets. But this outbreak is unprecedented, and there's a lot to learn, and there's a lot that we don't know. Again, most of what we can do today is really based on smallpox, which is as I think Dr. Elliott said, is a sister infection. And of course, smallpox is a devastating infection with a 30% mortality rate. So the country has been prepared to deal with smallpox to some degree, to a large degree, and monkeypox is just sort of fit in there. But now this is really unprecedented. We're going to be learning, but we all have to learn together.
Great. Thank you so much. Our next question is regarding some service providers like massage therapists and hairdressers. The question really is asking, like, how at risk are massage therapists? Clients are not always completely forthcoming with health issues, et cetera. So we know that there are, service provider industries that are working with our general public in a skin-to-skin or a contact way. So any recommendations on these particular folks?
I think we're all sort of looking at each other to handle this one. That is, I think, a very important and urgent question, especially as we come to understand that the virus itself can persist on environmental surfaces longer than I think anyone initially thought. So for the first part, direct hand-to-hand or direct physical contact with a client who has active lesions is, of course, a highly risky form of transmission. And so our provider for direct hand physical therapy, massage, et cetera, and so forth, I would consider at risk for that. So too the massage table, so too blankets, sheets, et cetera, and so forth. So I think we're coming to better understand that the virus can persist if you do nothing else up to 10, 14 days or so. That's a little on the concerning side. But what can we do about that? Well, of course, ultimately, when there are enough vaccines to provide pre-exposure prophylaxis, that's the goal, that's the gold standard. But in the meantime, very careful hand hygiene, very careful screening, and then routine cleaning practices for the tables, the sheets, et cetera. And heat, as you would with any other laundry, should be adequate to handle this virus.
And I would add one thing, we're all in the middle still of COVID. We have this pandemic remember the one thing we recommended to everybody: if you don't feel well, please stay home. So we would urge the community to take that lesson learned from COVID and keep it with themselves, not just for monkeypox or COVID, but for everything else. We know that diseases spread between people. And so it's just important for us to have individual responsibility for when we feel ill, that we stay home. Now, I want to recognize how difficult that can be for wage earners and certain people that don't have sick leave available to them, but that is our recommendation in this case too.
Great, thank you. So following up with the testing questions, where can folks get tested? Specifically, what are options for those that might be uninsured or underinsured or may just not have the ability to pay out of pocket?
Mariana, do you want to talk about that for Pima County?
Sure. So Pima County has been organized testing sites and evaluation with some of our community partners. And the AP team is able to coordinate with those community partners, and we have places where to send for evaluation. The most important thing is that you need to be evaluated by the provider. We can't just send you to test because you have a pimple. We need to know a lot of things, and we need to ask some questions to know your risk and kind of define if this could be that diagnosis. And that's why maybe people that go some places only to get tested are turning away. So we will connect you with a provider that will accept insurance or not. And if you don't have insurance, we also have resources. But the most important thing will be or connect with the health department or answer the question on the survey in our website.
Thank you so much, Mariana, for that. I have another question regarding like vaccines again. This keeps popping up. So the question is how old do you have to be to get the vaccine?
If one of you guys want to take that, we did just get clarity today. I can answer this.
Go for it.
Yeah. So the problem is I don't know about the neonatal stuff, Sean, but what I know is that up till recently, the vaccine was indicated for those 18 and over. Now we are, and I did talk briefly about that the vaccine's going to change the way we administer it for adults. The vaccine is available, and for people that meet criteria, for children that are 18 and younger. I'm not clear on the very lowest age group, though, is my problem. And it will be the shot that we've been given. So for adults, the shot changed to include what we call intradermal, which is under your skin. We've been doing it sub-Q, which is subcutaneous, which, as you know, most sites, shots, it's kind of how you experience a shot going into your arm. So for those under 18, the vaccine is available, and it will be a sub-Q shot. And Sean or Kevin or Sudha, do either of you know?
Yeah, again, the bottom edge of that has not been demonstrated, but keep in mind that this vaccine has not been safety tested, honestly, in any of the younger populations. And so it's based on predictive modeling, which, sounds good, sounds really good, but we honestly don't know how low one can go. The virus type itself is very much like the chickenpox vaccine and the measles, mumps, rubella vaccines that we give to children beginning at 12 months of life. And they're given at that age mostly because their immune systems, their ability to react to the vaccine, is known to react effectively. Any younger than that, that may or not be the case. So nobody that we've seen, we've been looking all day today, has put out a published bottom limit of vaccine age. My suggestion at the current time, based on science, would be 1 year and up. So from 1 through age 18, then obviously older for older patients.
Thank you. Kind of like a follow-up with that question. Excuse me. If you've had chicken pox, can you still get monkeypox?
Yeah, absolutely. Totally different viruses, sadly so. Related question, which I also saw on the Q&A, somebody who had a smallpox vaccination, those of us, self-included, who are, 50 and up may have had that. There may be some protection still persistent, but it may not be 100% protection against a high-risk exposure. And perhaps Drs. Nagalingam or Carmichael would like to comment further, but it may be partial protection at this stage. I would not go running rampant, though, treating patients immediately without barrier protection in the absence of that.
Yeah, I just was going to actually say the same thing. I was starting to type a response to that. Smallpox vaccine is pretty old now. Smallpox was an illness. Smallpox has a 30% mortality rate. It was eliminated from the world by vaccination. I like to remind people of that. The last vaccines were given around 1972, 73, I believe. So those vaccines are pretty old. In an outbreak, in the outbreak associated with prairie dogs, 3 people who had been vaccinated against smallpox got monkeypox. So I'm telling everyone right now, yeah, it's great. You may have some slight level of protection. However, when available, you probably want to get monkeypox, a specific infection or a specific vaccination. Revaccinate.
Great. Thank you so much. I kind of want to circle back to around the provider education that we talked about, that since it appears education may be rolling out to providers inconsistently, where should folks go to receive the most up-to-date screening, assessment, and treatment if appropriate?
Well, I think you have to, the CDC website is really very good, and it's updated regularly. Little trick, if you go to the bottom, you can see what the latest updates are and look what was updated most recently. I also want to thank the people here. The Pima County website, the Pima County Health Department website on monkeypox is excellent, and links to some of those CDC publications as well. There's a lot out there, so it should be pretty easy to find.
Also, if I may add, any provider that has any question, usually contact the EPI team and we can help clarifying some whatever question you have. We have also the last information, how to test, how to take the sample. We have all that information to help make it easier for providers that still don't know what to do. And that's probable. This, as everybody says, it's a new disease and it's a new kind of test, it's a new kind of sample. And for more of the people that don't know about medical, we really need to take the good sample, because if you take the wrong sample, then they cannot do the test and you need to come back and you need to do it again and you lose time. So anybody that needs any information, we are prepared to share that.
And I just want to say one thing. So you see all these doctors and our EPI people here. We are all working together in Pima County. None of us, I mean, I had a doctor say to me yesterday, if I read 2 articles on monkeypox, I think I'm an expert. So we're all learning together. The health department's role is obviously to make sure that we push out accurate information. But Suda at El Rio, we work with her all the time. Sean, we work with. Kevin's been a godsend for us. And Mariana takes all those calls in the middle of the night from the providers at the outlying clinics that are like, what do I do? So we have resources available and we are all working together to make sure we can protect the community as much as we can. Thanks.
Great, thank you. I did want to follow up. There was a question that came through. My apologies if Dr. Ellie, you already kind of spoke to this, but the question kind of wanted to do a follow-up. Want to ensure that, did they hear you say that the virus can stay alive on hard surfaces for 10 to 15 days? And then if so, can someone really get the virus from touching those surfaces?
Yeah, so I answered that one privately, but there are only a couple research studies, and as you just heard Dr. Collins say, that the science on this, the knowledge is emerging on honestly a daily basis. So there have been a couple reports by scientists who confirmed culturable virus, meaning virus that was alive and could be contagious, on inanimate surfaces that have been contaminated for up to 2 weeks. Now, that's not to say that every single bed sheet or mattress or massage table or kitchen counter is going to be contaminated for that long, but there is that possibility. Now, that said, the risk of acquiring monkeypox from the surfaces is far less than acquiring it from somebody who is actively infected with an active pox. And so I think, but before we go and sort of bleach and steam clean the entire universe, we still need to work on where the most likely exposure comes from. We've already heard about steps one can take to avoid that exposure. Hand hygiene has got to be a big part of this. Washing our hands, lavos los manos, has got to be the appropriate response to this. And then routine cleaning of environmental surfaces for those who think something in their environment may have been exposed.
And again, if I may add something, this is a typical question for the epidemiologist, as Dr. Sean says all of that. One important thing is you can use any disinfectant, but please read the label. In the label, if it says it will kill virus, it will kill this virus. But also in the label, there is a very important information, is the time that you need to leave it wet before cleaning, that so you really get disinfection and sanitation. Most of the time we do the and then one wipes immediately. Something needs to stay there for 3 minutes. Something needs to stay wet for more or for less. So please check that the label says kills viruses, and also check how much time you need to use it. That comes in all labels.
Thank you so much. I appreciate that. I know that I think I did ask this, but I just wanted to get some more clarification, because I think some community members are also challenged by, I know that we've talked about there's certain sites that people can get tested, but I think some folks are having a little bit more of a challenge of, what that looks like. I'm just hoping that maybe our panelists can maybe offer a little bit more advice on where folks can get tested if they feel like they may have been exposed or experiencing some of the symptoms that we've been talking about that's related to monkeypox.
I can talk about this from the county perspective, and I just put an answer in the chat. Our North Clinic at the Pima County Health Department on First Avenue, and we can make sure, I think there's information on the last slide that you guys will get, does do testing. Most of the tests that come through, the people that come for testing though, have come through a phone call, and people like Mariana have triaged those phone calls and indicated that that person should get tested. We also take those calls from providers and emergency rooms in town, and we can arrange for testing at that clinic. So it's not uncommon for us to get a call, not just from the individual, but from somebody who's in an ER, from the ER itself, saying, I don't know what to do. And we tell them what to do. So there are ways to get tested. And I'm really sorry, it sounds like this one person went everywhere. Going to a lab will not get you tested. I think that that's the important thing. And Mariana alluded to that. You have to have the sample collected by a healthcare provider and then an order done from a healthcare provider. Sudha, I don't know if you want to talk a little bit about El Rio.
Sure,
You
yeah.
guys do?
Yeah, that's great. So Mariana and I have been talking to each other almost daily. So we are ready to support the community. So if folks are uninsured or underinsured, we're happy to help care for those patients. And just like Dr. Cullen said, Sonora Quest and LabCorp, if you go on their website, they are doing the testing, which is how we're doing it through El Rio, but it must be collected by provider. So we'll work with the health department, and if a patient needs to be seen and evaluated, we're going to see you, we'll test you. If uninsured, El Rio will be absorbing the cost of that, and we are going through Sonora Quest and LabCorp. So the turnaround time for the test is about 3 days, and so far we've gotten all our results in a timely manner and just able to follow through with those cases as well. And I think the other big plug is some of those folks probably could benefit from pre-exposure prophylaxis for HIV, etc. So it's a nice gateway into finding a medical home here in Tucson.
Great. Thank you so much. I have a few more questions. I know that we want to be respectful of time, not only for our panelists, but also for folks around dinner time during this particular live event. The question is regarding to the vaccine event that happened this past Saturday. If you received an email from the health department and missed the opportunity to get vaccinated, what should that person do? Should they submit another interest form, or in terms of scheduling a potential new appointment to getting that vaccine? Any guidance or recommendations on what our community members may need to do for that if they're in that situation?
I'm reluctant to say this, but I'm going to say it. I would not submit another form. We will be having additional, what we call point of distribution vaccine clinics. Let me just turn around and look at the calendar. We believe the next one will be August 20th. And once again, this is dependent upon vaccine. However, vaccines are available at our clinics, all of our clinics. If you have the email that I think this person has, which says, please come and you're eligible to get a vaccine. So with that, they should be able to call one of the Pima County Health Clinics. Those numbers are on our website. We have 3, and they should be able to get vaccinated.
Thank you, Dr. Cullen. Also want to remind folks that, again, we do update our website, pima.gov/monkeypox, with this type of information. So if there's any updated information on vaccines, we want to make sure that we'll be able to provide that. I have one last question. I'm so sorry for folks that are submitting questions. We're not able to get through this. But the last question that we have, will there be a need for mass vaccination for monkeypox?
Kevin, do you want to take that from what you're hearing at the state?
I don't have an answer to that question at this point. I really don't. I think what's important to understand is that this outbreak is unprecedented. It hasn't happened before like this. And of course, we don't know things until they've already happened. So there's a lot of concern, but some data suggests that the current outbreak is really limited to people that are sexually active with multiple sexual partners. And that's why the initial focus has been on that group to try to stop this epidemic from growing. I think there's questions about that there may be some changes in the virus. From the virus may have changed slightly and changed how it's transmitted, but I really don't know where we're going to go. It reminds me much of the early days of HIV, where we really weren't quite sure what was going on. There are some advantages here because we have a vaccine, we have medications, again, from smallpox, from our experience with smallpox. I also think we have the lesson of HIV. I think we as a community need to be attentive to what's going on. We need to be careful. We need to take care of each other. We need to be careful about misinformation, about things that people are trying to say that aren't necessarily true. At this point, I don't think that it's going to be an easily transmitted infection like COVID. And so I don't know that we're going to need mass vaccination. But the other thing, the reality is we don't have enough vaccine for a long time to mass vaccinate, certainly for quite some time. So I think right now, there's probably not a good answer, but if someone has an answer, I'd love to hear it.
No, we appreciate that, Dr. Michael, as we're all learning. So if more information comes, we'll definitely want to update our community as best as possible. I know we are close to our time, and I kind of wanted just to thank all of our panelists, but I wanted to give an opportunity real quick if any of our panelists want to offer any final thoughts as we begin to close. I know we want to respect people's time, but I think this is an opportunity if things were missed that we want to make sure that we're highlighting. If there's any last minute information that I want to allow a few more moments to go ahead and allow our panelists to say a last few words that they like.
Well, you should never give me that opportunity, but Michael, you gave me that opportunity. So I would like other people too. But, once again, I just want to thank our community, and I want to thank you for participating in this. Pima County is an amazing, amazing place. And what we have seen is through the beginnings of monkeypox right now is once again our community coming together, the healthcare system coming together, helping to ensure that people can access care. I want to acknowledge the frustration, the difficulty that people have been experiencing up to now. Sometimes when we do a point of distribution vaccine pod, it can seem a little chaotic, which may have happened to some people Saturday, but just believe that we are working together. We are helping to ensure that the community can be as safe as we can. I'd love for the other panelists to say things too.
Yeah, welcome any of our panelists. If they want one last closing statement, please feel free.
I think Dr. Cullen summated it nicely. It's exactly that. We've really been working very closely together to provide the best care for our community. And I think knowledge is power. So just reading as much as you can, asking your providers as many questions as you can, because that's how we will get through this.
And I'll completely agree with that and what both have said. And I think that the biggest concern I have is that there are people in the community living with the fear of monkeypox who feel they don't have resources. And that I would hope those individuals would feel comfortable reaching out to providers at El Rio. And thank you so much for that service, to their providers if they have one, to the county. You're not alone, folks. Ask the questions, and then we can hopefully together work on addressing fears and getting confirmation if we need to.
And I would like to add that the EPI team is always happy to help, but also please be patient, because sometimes if you send an email, it will not be answered in 5 minutes, but we promise to try to get everything as a priority answer at that point of before the end of the day, or maximum the next day. And also the patient to understand that we're talking about the same thing, and the providers too every day. Maybe be quiet, not stay there and not do anything. We're trying to solve your problems and help you, but we also need a little bit of breathe in between to be able to give you the customer service that you deserve to. So
I think if maybe I could have one more thing, I think everyone needs to understand. I personally am not terribly concerned. Actually, I'm in Providence, Rhode Island right now. I flew today. in flying here, I was much more concerned about getting COVID than I was about getting monkeypox. So I know it feels like just another disaster, the way you might read it in the press. Right now, it's not a disaster, and lots of people are working very hard to try to prevent that from happening. And I think I see some of the messages I've seen. Probably people are a little more anxious than they need to be. It's really about, as Dr. Cullen said at the beginning, it's about your activities. And if you're having unprotected sex with multiple men, then your risk is increased. But if you're not, your risk is not that high at this time. Things could change. And I've been wrong before and I'll be wrong again. But right now, I think everyone needs to pay attention, to take care of themselves, to take care of each other, and let's get through this together.
Thank you so much, everyone. I just want to remind everyone that, we know that there's a lot of questions that came through. These are amazing questions. We want to be able to get them as possible. So we apologize if we weren't able to get to your question, but we will do a follow-up and send an email to all of our registrants with some details and answers to the questions that we may have missed. We really want to be able to be proactive and be able to get those answers. And again, as they're coming through, using our website for information. I do want to thank our panelists again. Thank you so much for your time. Thank you so much for our community members for joining us in this conversation. I'd love to bring Tim back to help us close this out this evening. But again, from Pima County Health Department, I thank you for everything that you're doing. Thank you, Dr. Collin, Dr. Nagliman, Dr. Carmichael, Mariana, and Dr. Elliott. We really appreciate it. And then again, the partnership with TMC. Thank you so much.
Thank you, Michael. Thank you to all of our panelists. Tucson Medical Center so appreciates our partnership with Pima County, the Healthy You, our series of healthy conversations. It's really been a service to the community. So thank you very much. A couple of house cleaning items just to wrap this up. If you did have a question and you're watching this after, and you're watching this on another platform, you can put the question into the comment section and one of our experts will answer it. We'll also host this, if you're watching tonight, maybe you tuned in late, but this will be on TMC's YouTube page in the next 24 hours. We'll download it and then upload it onto YouTube so that you can watch it and share it. So Michael, thank you again. To our panelists, we'll see you at our next panel. And to everybody that's watching, thank you for joining us. Good night.
Thank you.